Welcome back. This is Earl Stephenson Jr., Atlanta board certified plastic surgeon, and welcome to Sketches in Surgery. This new segment we're kicking off is entitled Facelift. It's actually going to be face and neck lift, but the focus will be entirely on improving the aesthetics of the face and neck. If you're unfamiliar with me, please look at the other videos I have on my YouTube channel and look at the other segments from Sketches in Surgery that describe male chest contouring for male breast or male breast reduction called gynecomastia, and for enhancing your chin with a sliding genioplasty. So I invite you to watch those segments, but if you're specifically interested in improving the aesthetics of your face, you have some droopy skin, you have some jaws, you hate your neck, then this segment's for you. If you're unfamiliar with my channel, I invite you to subscribe and like and make comments. So with that being said, today we're going to use my fancy kind of dry erase board desk. Is great, and I instituted this because it's just easy for me to draw here and I can explain, and hopefully you can hear me clearly if I can speak, and we can go through and make alterations on this cool desk. So I wanted to touch on two things today. I want to touch on areas that a facelift treats and the incisions, and there'll be several episodes in this segment where we'll talk about the types of facelift, what can be done in the neck, and some complementary procedures in passing that kind of go along with a face and neck lift. But I want to really start about what a facelift is and what it can do, meaning the areas that it can treat. A facelift really takes care of a couple of areas. It takes care of what we call the jaw area, and I'm just going to use my little drawing here to show you and kind of illustrate the area of the jaw that can be affected or can be successfully treated with a facelift. So that's one area, the jaw area. It can treat sagging skin or neck skin, so it can certainly help that. It can treat what we call kind of our smile line or 11 line, which is medically known as the nasolabial fold. So it can help improve this general area right here of the fold and somewhat of the cheek. It does not take care of anything in your brow, so it doesn't lift your brow. It doesn't really change the dynamics of your chin per se. It changes the contour of the lower neck, but not the chin. If you have a weak chin or a prominent chin, then that is a separate procedure that can be done or enhanced at the time of a facelift. So again, I'm going to just kind of draw an illustration of what kind of the areas that it'll treat. So I'm going to use this yellow marker to kind of outline kind of a neck that might be a little bit saggy and full. And then if we drew a jawline there, then we would have this kind of weak lump there. So again, we would have the jaw area here. That's what we would treat. We would treat the neck. We would treat the nasolabial fold area. So it really is a very powerful procedure for the lower face. The upper face can have treatments provided at the same time. Excuse me. But in order to do that, you'll need separate procedures. So again, just for clarification, that's a little messy, that outline, so I don't like that. So I'll just circle the areas. So we're going to kind of treat the cheek, and I'll put that there, and nasolabial fold. Okay. And we're going to treat the jaw, and we can take care of the neck as well. So those are three areas that can be readily improved with the facelift. facelift involves lifting of the skin and treating the underlying weak or saggy muscles that give us fullness in the cheek and nasolabial fold, that give us fullness in the jaw area and fullness in the neck. So we will discuss what those specific muscles are individually and as a collective in a separate video. But today we just want to kind of highlight what a facelift can do. A facelift does not treat the brow. So it does not treat the brow. So no brow. You'll have to use a separate brow lift. So no brow treatment. It does not treat any eye problems. So if you got loose skin of your eyes, you'll need a separate procedure called an eyelid lift or blepharoplasty. It does not treat the chin. So it does not really help your chin. So again, no chin. And let's say here again, no eyes. Those areas can be treated separately. That can be done or treated with a brow lift. The eyes can be treated with a blepharoplasty or eyelid lift. And the chin can be treated with an implant or a genioplasty. So there are basically, in my opinion, 3 areas that can't be treated solely by a facelift and 3 areas that can be treated solely by a facelift. So again, really important to understand when you look at yourself in the mirror, and we all do, and we're pulling our face up with our hands and we're pulling everywhere that we can pull. Yes, we can do that with the hands, but our facelift, a traditional standard facelift, can't do everything. It can do most things, but not everything. Okay, so having said that, let's look at the area of incisions. There are really a couple incisions that can be used. I'll kind of talk about the traditional incision that occurred early on. So I'm going to use this red pen and I'm going to draw the incision. So the incision early on, and I'm going to draw these dots, kind of hugged the ear in front. It went around the ear and then behind the ear, and then it went in the hairline, and then it went up and let me get closer. I'm a little further away. It went, there we go, perfect. So it went up the hairline into the hair, and it went close to the crease of the ear, underneath the ear, behind the ear, and then out toward the hairline this way. Well, this is the standard procedure, and it's hardly ever done today, because when you move the skin back and remove it, you're moving it in a general direction, and different what we call vectors or directions of movement. You're basically moving the skin this way. And when you move the skin this way, if you have an incision in the hair, the hairline is actually going to move back. So if you have somebody who has a really short distance between the edge of the hairline and the corner of the eye, maybe you can do that, but most people don't have a very short distance. A distance of 5 centimeters or more really indicates that you can't use this type of incision. So we just, as modern day plastic surgeons, just avoid that. You can get a shift in the hairline in the same way when you're doing the neck. When you're operating in the neck and you're moving and trying to remove this excess skin, you're typically removing in that vector or that direction, and you can shift this hairline at the edge up, which gives you a really weird look. if you have a lot of skin, that you shift this back hairline up and this brow kind of sideburn hairline back. So we really don't really perform those types of incisions at this point. What we do is, and I'm going to go over to a less artistic version of the face over here. Let's erase some of this. Let's just do this. This will work. So what we do is, instead of going in the hairline, what we do is we go just at the edge or inside the hairline. We follow that down. We come and hug the ear, and then we kind of follow the ear, and then we kind of go behind this little pointy part, come back out to the surface of the ear and really hug it. And then just like the first one I showed you, we go behind the ear, and then instead of going straight across from behind the ear into the hair, we follow the hairline down. So now you've got, and I'm going to draw this really boldly, you've got an incision that really hugs the hairline. So when you move that skin, the hair is not going anywhere because the edge of the hair has not been lifted. It's just been kind of separated from the skin in front of it, and anything in front of it can be moved and then removed and then sewn to the fixed edge of the hairline. So you can get great improvement as far as contour by removing the excess skin without altering the hairline. So this is your standard type of incision. You can shorten the incision, and let me kind of show you what that may potentially look like. And I'm just going to kind of draw on top of this line a little bit using a blue marker. This is our standard incisions, red. You can use the same incision, and you can follow the same course right around to the ear, and you can kind of stop it on the back of the ear and kind of gather skin there and not have this incision in the hairline. If you have someone who doesn't have a lot of skin, who doesn't need a lot of neck work, or have a lot of loose skin in the neck that you need to also remove, then this short scar incision, the blue, is really helpful. I find in my patient population that most clients are mature / older, and they have redundant or a lot of excess skin, and they really need skin removed in front of the ear, for lack of a better term, and in the neck. And so you need more of the traditional red standard incision, as opposed to someone who may be younger, who has a modest amount of skin excess, and they can use this blue line, which is shorter, which ends at the very back of the ear and does not go down the hairline. So again, you can use a traditional incision, a short scar, or short scar incision, which is the blue incision. So the red incision would be traditional, that travels and hugs the hairline and ear. The blue incision was a short scar incision, hugs the front hairline, hugs the ear, and ends in the crease in the back of the ear, well hidden. So in my opinion, there are two basic versions of this. There are many kind of marketing names given to these incisions, but this is really kind of the nuts and bolts of it. These are the two incisions that are typically used. Now, I didn't really touch on if you really need to do a lot of work in the neck. We obviously have this incision here if we need to have a lot of neck skin that hugs the back hairline, and we can kind of get underneath the skin and work on the muscle and things there. But you may need a front incision underneath the jaw, and I'll just kind of put it right here for just purposes and of this video, but I'm going to use that. Now, some people will use this small incision to kind of take care of the front of the neck, the musculature there. And they'll use that with a short incision, or sometimes they'll use it definitely with a long incision where they've treated the back side of the skin and neck and the front side of the skin and neck. So this what we call submental incision, which means beneath the menton or beneath the chin, can be used with the short scar, blue, hence blue, or it can be used with a long scar, traditional incision for the face, and that's in red. So, again, I don't want to overwhelm you. Facelift is a very, in my opinion, elegant but demanding operation, and I really want to break this down into a series of small digestible videos of about 15 minutes, and I really wanted to focus on this one about the areas that we can treat, which is the cheek, nasolabial fold, jaw, and neck. Areas that we can't treat, the brow needs another type of incision and operation along with the facelift. Can't really treat the eyes if you have saggy skin there. Another operation can be done at the same time as your facelift, which is a eyelid lift or blepharoplasty. Can't really address the chin with a facelift only. You'll need either a chin implant or a sliding genioplasty. So those are the areas that we can treat. And we talked about the incisions. The standard red incision that goes and hugs the hairline and around the ear, or the short scar incision, which is the blue incision that kind of follows the standard red but stops right behind the ear and is hidden there. And if we really need to do some additional work in the front of the neck, we can use a submental incision or just in the neck skin, just below the crease of the lower jaw, either with a short scar blue or a traditional scar or incision red. So again, hope this was helpful and not clear as mud. Hopefully, if you have any questions, you can certainly leave comments below. I'd certainly check these videos so I can answer any questions. If you're interested in a more in-depth conversation, I invite you to visit my website at www.esjaesthetics.com, or I invite you to schedule your personal conversation with me in my office by making an appointment. So until next time, we'll see you at our next episode of Sketches in Surgery. Our focus this time is facelift. See you soon.